Collaboration has been a huge theme running through our day yesterday, and when we were talking to everybody, and it was really something that came out very much with all the patients and even with the stakeholders that were in the room. Collaboration is really important because we need to be able to deliver care in a method. And what is becoming more and more apparent is the hybrid approach and the hybrid models of delivery of care. So it's not just, it's when you're, particularly if you're a tertiary centre where you have referral centres coming in and patients having to go back very quickly to their referring centres or whatever because to demand and access and accessibility. So collaboration is really important, and often nurses are linchpins in that because they're at a point where the patient feels comfortable in talking to them, but also nurses in other centres are going to approach a physician to ask a question. But the nurse in the centre is the person that is kind of a linchpin with the information giving. And I think that's been really important throughout the thing. And even like Danielle yesterday, when he was doing his talk, the patient saying that when he gave them information, why haven't they been given that information beforehand? So it's often the place where and that's where nurses are a linchpin in it, but they also have to be part of the thing. They have to be part of the multidisciplinary team because nurses have a much more practical approach to things. So yes, often physicians can get very tied up in and the science of it and the thing, but nurses are, how do we practically deliver this care? What do the patients need? What is the best way? Assessing the patient's need. Have they got an appropriate caregiver? If we're going to do an ambulatory model, have they got do you know what I mean? So that's where the collaboration and the linchpin is needed.